All right, hello, Miss Hogan. My name is Emily Reginald.
Hello.
I'm going to be your student physical therapist today. Is it all right if I ask you a few questions?
Yeah, it's fine.
Okay, can you tell me what brings you into therapy?
A week or two ago I had a stroke, so my doctor thought it would be good for me to come to therapy.
Okay, can you tell me about the symptoms you've been having?
I feel very weak on my right side. I lose my balance really frequently, and every once in a while I fall. And I feel some numbness in my arms, so.
Okay, have you been to any other doctors since your stroke?
I've just gone to my regular doctor, and he thought I needed to have like speech therapy, OT, and PT. So.
Okay. So, do you have any pain, or is it just numbness and loss of balance?
It's mainly just numbness and loss of balance, and occasionally I have pain in my leg, but I don't really know why.
How's your vision?
It's a little blurry every once in a while. Like, it's really clear some days, and then all of a sudden it'll like go blurry. So I don't know what's going on with it.
Okay, that's definitely something to look for. What has life been like since your stroke?
It's been really hard because I'm not able to do the things I used to be, and I'm not independent. Like, the doctor hasn't cleared me to drive, or like I'm not able to take care of my little girl who's only 2 months old on my own yet. I don't feel safe being home alone with her, so somebody always has to be with me. So it's just really hard.
That is really hard. Do you remember the stroke at all, how it happened, what you were doing?
All I remember is 1 minute I was feeding my little girl and joking around with my husband, and the next moment I remember waking up in the hospital not knowing what was going on. It was really scary to me.
Did you have any conditions or diseases prior to the stroke?
Not that I know of. I was a pretty healthy individual, and then every once in a while I'd get shooting pains through my arm, but other than that, no.
Did you have a family history of stroke?
My uncle had a stroke a while ago, but other than that, I don't know if anybody else in my family has.
Okay. Can you tell me about your condition? Does it change from day to day, or is it pretty consistent?
It's pretty consistent. Some days I feel better than others, but it's more like the energy level. But mainly overall, I still have weakness in my right arm and my right leg, and I just feel very tired. It just takes a lot more energy out of me to do the same tasks.
So are you right-handed?
I am right-handed, so having to do everything with my left hand is really hard. It's hard because I'm uncoordinated with it, and it's just hard because it's not as strong, obviously.
Can you tell me a little bit about your home environment?
I live in a 2-story house, so it's kind of hard to go up and down the stairs, so I've been sleeping on the couch. And I live with my little girl's room's upstairs, so that's kind of hard. So if I do want to go upstairs, I kind of have to crawl up there, but it's not bad.
Is it more out of anxiety or fear that you might fall, or have you actually fallen multiple times?
I've fallen a couple times, thank goodness I wasn't holding her, and then other times I just randomly lose my balance. I'm standing there, and then I felt very dizzy and I'm gonna fall, but I have to hold on to things or sit down before anything bad happens.
Are you pretty good at touching yourself?
I would like to think so. My husband does not think so.
Okay, so
because
your
last time I
husband's
fell, I just fell onto the floor.
Is he able to help you out a lot at home, or do you have anybody else that's able to help you at home?
He helps me when he can. He works 3 days a week, 12-hour shifts, so that's kind of lonely when he's not there, but when he's not home, my mom comes over because I still don't feel comfortable, and I don't think they feel comfortable me taking care of my little girl on my own. Mm-hmm. So my mom comes over and helps me when with the things I can't do, but she tries to help me be as independent as possible. She's just there as a safety in case something bad happens to either of us.
Well, that's really good. You have a good support system. Do you have any assistive devices that you have to use throughout the day, or is it pretty much you just utilize people around you?
I try to utilize the people around me. I know the doctor said I might have to have a couple things to help me, but he didn't specify what. But
you're using your handrails on the stairs and everything.
I don't use the handrails on the stairs just because I can't go up them normally. I have to scoot up them.
Oh, okay.
So,
I see what you're saying.
But getting up, sometimes I have to use the handrails off the toilet or out of the bath or
Okay. So can you tell me some more of the frustrating challenges that you have to deal with throughout the day besides, obviously taking care of your child is very important, but what about little things like brushing your hair, brushing your teeth?
I know, like, that's challenging because I have to do everything with my left hand because, like, my right hand is still so, like, weak that I can barely do those things. Or, like, washing my hair, I can only do it one-handed because I can't get the other hand up that high because it's just so, like, it's hard. And then, like, putting on clothes is kind of hard at times, too, just because, like, when you have half your body that doesn't work with you,
Right.
it doesn't help very much.
That's gotta be very difficult.
It's just very challenging throughout the day because you don't realize how often you use your right hand for things, and doing everything without both hands is really hard.
Are there any activities that you did previously before your stroke that you really enjoyed that you feel like you can't really do anymore?
I did a lot of swimming and biking, and I'd, like, go to the gym and take Zumba classes, but I can't do most of that anymore, like, especially swimming because I can't use my right arm. Biking, it's not as easy because I could just, like, make my other leg work, but I can't go to the gym as much, and then, like, I like to volunteer, so I'm not able to get out and do that, and since I can't drive on my own, I can't, like, I don't want to do it as much because I don't want to rely on other people trying to take me places, so.
So when you say you don't get to exercise as much, does that mean you still do sometimes?
I guess not, no. I've tried biking, but it was more hassle than it's worth, so I just normally stay at home. And I don't want to have somebody else take me to the gym.
Do you tire pretty easily now?
Yeah, I do. Some days are better than others. Like, I don't know if it's because it just takes a lot more energy out of me to, like, do everyday tasks, more so than I used to. It's hard.
How is your memory since the stroke? Has that changed at all?
I would like to think it doesn't change, but my husband has noticed little things, like I'll freak out because I'm like, we didn't buy milk, and he's like, babe, you already put it in the refrigerator. Or I'll be like, I don't remember things as well as I used to, and I don't know if it's just me being so, like, tired or if it's, like, memory loss from the stroke, so. But he thinks I've been losing my mind lately.
Some of it could be just because you're a brand new mom.
Yeah.
Might be a little tired anyway from that 2-month-old baby.
Very true.
Okay, can you tell me about your behavior, your mood? Has that changed at all, your personality that you know of?
I've been angry lately, and I don't know if it's from the stroke or if it's just from, like, the side effects. Like, I feel like I can't do anything on my own, so I feel very dependent, and it just makes me angry, and I'm taking it out on my husband when he's doing nothing wrong. It's just, I feel so helpless and like I can't do anything, and it makes me feel bad that I can't feel safe just holding my little girl anymore, that I'm always scared that something bad's gonna happen, or I just can't do the things I used to do. So that's just, it's, like, scary and frustrating at the same time, so it just makes me a mad person.
That's very understandable. Can you tell me, like, how determined are you and how anxious are you to get started on therapy? I mean, if we could start today, would you be willing to do anything it takes?
I am. I want to get back to the way I used to be. I want to be able to hold my girl. I want to be able to, like, go to the gym and drive. Like, I am willing to do whatever it takes because I want to get back to the way I used to be or close to it. I don't want to have to rely on anybody anymore.
Those are definitely your long-term goals. What are some of the short-term goals that you feel you would really want to reach as soon as possible?
If I could, I want to be able to get my balance a little better. Like, maybe not perfect, but just work on, like, how to manage my balance, and then be able to, like, strengthen my arm a little so I can do something with it, even if it's just washing my hair or brushing my teeth. I want to, like, strengthen that so I can do more things.
Well, I definitely think physical therapy is going to be very beneficial, and we can definitely meet some of these goals. You just have to be very determined, and so do I.
Well, that makes me happy.
I'm really anxious to get started in helping you.
Thanks.
It was really
nice
great
to meet
you. Thank you.